How do you know if you're doing the right rehab exercises for your specific injury? This is exactly what we'll cover in the fourth stage of this 10 video series to overcome your injury and reframing the way you think about your rehab. If you haven't seen the first 3 videos, click on the playlist above, which will take you to step number 1. If you are up to date and have watched the previous videos, you have established your current capacity and you've recognized the importance of the rehab ladder while following the acceptable pain levels. So far, most of this is quite theoretical because I haven't yet shared any rehab exercises for you to follow. If you already have your rehab exercises, fantastic. But if you'd like to know my favorite rehab exercises based on my years of working with runners, keep watching. And this is kind of a tough video to make because there are a number of running related injuries out there and there are thousands of potential rehab exercises, but Cody is here to demonstrate the most important and the most effective for these common running injuries. This is pretty fast paced, I'll give you a bit of a warning, so hold on to your hats, ready and go. So for patellofemoral pain or runner's knee, start with wall sits, progress by adding weights, then adding movement, before progressing to squats, while also doing some sort of single leg exercises like step ups and lunges. The rep ranges are about 3 sets of 10 reps, and the weight can continue to progress gradually. You want to focus on your glute med strengthening for ITB syndrome and for lateral hip pain, so you can include some crab walks. You can also do hip hikes and hip thrusts with a resistance band. Each of those about 3 sets of 12. Rehab for shin splints focuses on the calf complex, more specifically the soleus muscle, so bent knee calf raises are crucial. Progress in weight with the rep ranges of 3 sets of 8 to 12 reps, and you can also do tibia strengthening with a resistance band. For plantar fasciitis, start with double leg calf raises with big toe extension, and you can eventually progress to adding weight, then progress to single leg and single leg with weight. After that, plantar fascia strengthening can be more functional. I like to do barefoot walking or just simply completing your gym workouts in minimalist footwear. Next, we have Achilles tendinopathy. You want to start with slow, heavy load, mainly doing eccentric calf raises. Once you're tolerating a lot of these, continue the eccentric stuff, but gradually add in more concentric work. If returning to running is still an issue, then we want to try and bridge that gap a bit more. Try faster tempo calf raises, and then you can progress that to using a jump rope. For calf strains, they're very similar to Achilles rehab, but without the initial emphasis on eccentric work. Next, we have proximal hamstring tendinopathy. If you do have PHT, check out my Overcoming PHT podcast, but my favorite is starting with deadlifts. You can start with half range of movement before slowly progressing through the range, and then you can add weights. The other 2 that you want to add are hamstring curls and weighted step ups. I've put in hip flexors as well, and they're not that common, but if you do have a hip flexor strain, I only have one good rehab exercise, and that is resisted hip flexion with a resistance band, and you can progress with a tighter band. You can also progress by keeping it to an upper range only and eventually working on speed. Lastly, I thought I'd put in here stress fractures, which it depends on the level of severity and the location of that stress fracture. I don't have any exercises for you, but just want to mention that stress fractures are the exception to the rule, and you do need to follow the advice of your medical team and slowly reintroduce weight-bearing exercises, but needs to be 0 symptoms. While this video is quite rushed and overly simplistic, it's to be used as like a rough template for you to follow. Every presentation is unique, and if symptoms aren't improving week by week, it is usually best to get it medically assessed. Which brings me to my next stage of the rehab journey, discussing if your injury should be assessed by a health professional, and if you do need to recruit someone, exactly what questions to ask and how to make your consultation as effective and efficient as it can be.